I found my favorite live streaming now. It used to be, I still play with Facebook.
Mm-hmm.
What's up, Instagram? Trying to build the audience on both. Facebook has become very good for advertising, but not very good for just organic reach anymore. Instagram's better for that. PTC. Oh, Gazelle. How's it going, Gazelle? Gazelle's on.
Yeah, it's a long time.
If you are close by, we are in the 92408 right now. Come on as a podcast guest.
You don't have time to be viewing Dan on Instagram. You should be working.
Source data verification. Immediately.
CRA activity.
Hello, Nita. Where are you from? Okay. Hello. Okay, so episode 130.
9, I think you said.
No way.
6.
134.
4.
Yeah, 134.
Yeah, that was close. It's only off
From
by 5 at the
California.
most.
Oh, very good. Oh, Gazelle's on medical leave.
Everything okay, Gazelle?
From California. Where in California? Both people are on right now from California. Very good.
Well, one person's only a 10-minute drive from us.
We're in the 92408. Both of my eyes. Whoa. Hemorrhaged? Holy crap.
Flying?
I don't know. That's Gazelle.
Yeah, from flying, or how'd that happen? Deep sea diving?
Gazelle was in our first class ever.
Second, wasn't it?
No, first.
Was it first?
Wait. Yeah, first. That was, geez, I don't even remember. 2016. Wow.
Time just flies.
Oh, diabetes. Yeah. Gotta be careful.
Sorry to hear that.
Got to be careful. Take it easy for a while.
Get your blood sugars under control.
Feel free to stop by when you want at the clinic. Okay, ready? 134?
134. I don't think this is going to be too much, because I don't think you're going to get too much from this, but maybe you want to open your own site.
Wow, that's very good. Okay, here we go. Guru Nation, welcome back to another episode of Random Musings from the Clinical Trials Guru. We've been pushing the podcast hardcore, right?
Sure.
Chris Sauber's here with me. Chris,
Hello.
introduce yourself. What if episode 134 is someone's first and they're like, who's this dude? Well, they can't see you, but on Instagram Live, you're wearing an AC/DC shirt.
Yeah, I went to this concert like a year ago.
As Luke Eddington says, Akadaka.
What they're called in Australia, which I didn't know.
Luke's not on. I think he's still asleep. Who are you, Chris? Speaking to the mic. They need to hear you.
Nobody.
Okay. So besides nobody, who are you?
Silent partner. Well, the less
You're not silent.
Less silent these days.
You are not silent at all. More cerebral partner. Older partner.
Fair enough.
Older.
You're so funny.
Significantly older.
Okay, older, not significantly.
Okay, so sales. We're talking sales on the podcast.
Yep.
So, people in research tend to not think of themselves as salespeople.
And that's exactly what they are.
Why?
Every aspect, every component, and every one of them requires a certain amount of salesmanship. Every one of them. From getting the study, to populating the study with patients, to solving problems within the study, whether it be, something you did or didn't do correctly in regards to the protocol, even requires salesmanship. You're going to be talking to the project manager. You still need to sell your site that, hey, don't shut us down. We can correct this problem. We can still bring on enroll many more patients. It's all sales. All of it.
All of it. Even if you're an employee, you're selling yourself.
Sure.
Right? with all the turnover that goes on in the industry, you're selling yourself. And the reason we've done this topic before, but years ago, at least a year, or if not more than a year ago, sales is such an overlooked skill in this industry because it is science, it's research. The stereotype of sales is not there. Like, and we talked to
you're not a car salesman here. No,
right,
of course not.
Right, but we've talked to so many people every day, right? Potential students, potential clients, people who are CRAs looking to start a site, people who are CRCs looking to be CRAs, people who are CRAs and are sick of their job and want to be consultants.
Or start their own site.
Or anything, right? Yeah. What would you say? I would say half of the people we talk to lack confidence.
For sure.
And that's like the key ingredient to being good at sales.
Yes, absolutely. You need to be confident within yourself to express your capabilities and what you can do to achieve whatever it is you're trying to achieve.
And even if you're a manager, let's say for a CRO, like a big CRO, sales, I mean, you got to influence people underneath you to do things your way, right?
Sure.
Like, that's a good skill to have. Of course, if you run your own business, your own clinic, sales is important. That goes without being said, but we're going to get into a lot of that.
So would you say, from your manager spiel there, would you say people skills is a big part of sales skills?
Yeah, of course. A book everyone should read. I don't even know if you read this. How to Win Friends and Influence People by Dale Carnegie.
So does Dale Carnegie say that people skills is a key component to sales?
That's what the whole book, like the whole thesis is about.
Yeah.
Yeah. Everyone should read
No,
that.
I agree with that. I was just putting it out there because really to be a good salesperson, you kind of have to be a chameleon.
Explain that into the mic if you can.
So you have to speak to your audience, right?
Mm-hmm.
If you have somebody that's very interested in technical details, then you kind of have to come from a technical perspective, right? You're selling from a technical perspective. If you're speaking to somebody that's all more about sunshines and rainbows, then you have to speak from that perspective, right?
That's right.
So you just have to know your audience and speak to them, right? Speak to them in the language that they want to hear.
Anyone on Instagram who has a question for the podcast, let us know live, and we'll feature it. So anything, but we're going to talk about sales. So in your experiences with, my theory is like half of the people we talk to they lack confidence. I think an even greater percentage are bad at sales, because you can be confident and still be bad at sales.
Sure.
So how does one develop this skill, Chris? You used to do sales, right?
Yeah.
Way back in college?
When I was in college, I sold cars for about 6 months and absolutely hated it.
1930?
Haha, you're very funny. No.
Great Depression? Was it tough?
Yeah, I made $1 a car.
You sell the Model T? You sell a lot of those?
Yeah, they were a great car.
No, so seriously, how did you build up your sales skills? Because I used to suck at sales. I used to suck at interacting with people.
Well, so when I did it, I was quite young, like 20, and I wasn't great at it, and I wasn't a chameleon. I didn't play to my audience, but what I did do well was I was friendly, right? I think that can overcome a lot of any lack you have in other skills, right?
Just be friendly first.
Right. Just be friendly.
Be likable.
Exactly.
You know how many people that consider themselves good salespeople are not likable?
Yeah, like half of them, if not more.
And the scary thing is some are successful.
Yeah.
What does that tell you?
Well, you can bully people into your position, I suppose.
Because we know somebody like that
Sure.
we just left
Sure.
a building from.
Yeah.
Not personable at all,
Nope.
but does pretty well.
Sure.
We know a lot of clinic owners that are assholes,
Yeah.
and they do very well.
Sure.
So, you think they could turn it on and off, or they're good at manipulating, or what is it with them?
Or maybe they have the right people in place to do that for them. Also. But like when you're speaking of the person with the building we just left, I would guess that person can turn it off and turn it on.
Yeah.
Would be my guess.
Same with another guy that we know. We have a student who works for him.
Okay.
You know who I'm talking about?
Are they in Anaheim?
And I can't tell you where they are because they probably listen.
I don't know what you're talking about.
We have a student
Mm-hmm.
in the Site Owner Academy.
Okay. Well, yeah,
Works
okay,
for
now I know what you're talking
A
about.
big clinic
Yes, I know.
somewhere in the United States.
I know what you're talking about.
So
Need say no more.
that guy could turn it on and off, right?
Yeah, okay, so he actually doesn't come off
Unlikable.
in the very first meeting, right? In the
Yeah.
first 20 minutes, he doesn't come off that way.
Yeah.
Once you get to know him a little bit better, right, then you understand.
Uh-huh.
So sometimes it takes a little bit of background context to know the person to say, hey, how does this person get it done, right?
Okay. So let's go to the sites because that's real. I mean, if you're just joining or just listening here, no matter what you do in this industry, I don't care if you're an employee with no ambitions of being an entrepreneur or an independent contractor, sales is an important skill to learn because do you want to be stuck in the same job the rest of your career? Maybe you do.
Well,
But
even if
even
you
then
want
sales
to,
is good.
absolutely, because maybe you want to move up the food chain.
Or maybe you just want to not be treated like everyone else when you have 30 years at the
Well,
company.
If you're a CRA and you want to move up the ladder a little bit, yeah, still take sales.
Or if you're a CRA and you want your CRC at one of your sites to complete a request for you,
Sure.
you can do it like some of our CRAs with an iron fist,
Sure.
or you can be very salesman
Yeah.
like.
But again, I think so long as you're friendly, you'll probably get it done, most likely.
Right. But speaking of which, a lot of CRAs could use classes on empathy and people skills and
Sure.
sales.
Sure.
And they're starting to hire for that now.
Yeah.
Yeah.
To teach a person how to be friendly,
They're starting to hire with risk-based monitoring.
people skills and be friendly.
Yep.
Yeah.
Now it's supply and demand, and there's still a shortage of CRAs. So anyone out there watching that wants to be a CRA, it's a good time to do it. But get started as a coordinator first, or trial master file, regulatory. Just like the interview yesterday with John, who, knock on wood, got hired today, right?
Yeah.
Signed all the papers. He just had to pass his background checks, which in the past was a problem for this guy. Watch
Too
episode.
many unpaid tickets, huh?
Yeah, listen to episode 133 if you don't know what we're talking about. Okay, so now let's move away from the employees, the CRAs, CRCs.
So we're going to focus on site.
And CRCs need to be good at sales because you're interacting with patients. And you need to sometimes convince
Which we can
patients.
discuss in the site when we come to the site.
Oh, you want to save that for them?
For the site.
Okay, so let's get into the sites now. What?
So where does it start? You have to get a study at your site,
Okay,
right?
So how do you
well,
do that?
you can even step back.
No,
from
no.
that. You have to get a PI.
you have to get a PI first. So, a lot of people we talk to, they want to open a clinic, but they don't know how to approach PI because, again, they're lacking confidence or they're shy or they don't know where to start or they're overwhelmed, right? Mm-hmm. In my opinion, and we'll get Chris's opinion next, in my opinion, the best remedy for being afraid or not knowing what to do or being shy or lacking confidence is to just do it. Just go out and do it. If you are afraid to go talk to a doctor's, go to a medical building and start knocking on all the doors. By the third, fourth door, you're gonna be over it. Like you will no longer be as afraid as you were just anticipating the fact that you have to do it.
Well, some people might, but most wouldn't, right? Because you're accustomed to it now. You're over the rejection and If anything, you might have a little bit more adrenaline because now you're getting aggravated. And
That's not good either.
No, it depends on how you utilize it, right? So aggravation can be a motivator as well, right? It just depends on how you display it. So you might be getting aggravated, and so long as you don't come off hostile, you're fine. It's just a matter of, okay, I want to get this done. How do I get this done? Right?
Yeah.
Opposed to, no, I'm afraid to open my mouth and speak to anybody.
Okay.
Right?
So just go out and do it? Do you agree with this?
Sure.
Do you have any other strategy?
Well, I mean...
You're more cerebral. You're my more cerebral partner.
When it comes to getting PIs, we have a number of different ways that we can go about it, but I think that's a good stepping stone, right? Just going out and trying and speaking with people. Because if you start utilizing, say, advertising, and you'll probably have more responses that way, and it will take less time.
Yeah.
Then you'll have a better understanding of what kind of questions you might get from doing this face-to-face. And you'll be a little bit more relaxed when you actually have... Because if somebody responds to an advertisement, then they're definitely interested, right? So you'll have a little bit better understanding of where it's going to go and how to answer what questions they may have, and you'll be less fearful.
People are afraid of what they don't know how to do yet.
Sure.
So the best way to fight that is to go out and do it.
Sure.
Whatever you're afraid of, because you're going to learn. Then you're going to realize, well, my fear was unfounded, or maybe it is founded, right?
Well, a perfect example would be we did something just recently I'd never done before. And
what was that? Can't talk about it?
Yeah, but...
you got a hint?
Was over it, we did it for a while.
No clue.
It was cold. Did it and was over it.
New York?
Yeah, in like 20 minutes.
Okay.
Right?
I still don't know, but yeah, okay.
Well, just anything you do that you've never
Go out
done
and
before. Right.
And then it was better?
Never done
it was
before.
good?
Sure.
Okay.
Sure.
Huh. Any questions on Instagram, let us know. Episode 134 of Random Musings from the Clinical Trails Guru podcast. Okay, so find a PI is your first thing, right? Obviously, you got to get good at sales to convince a PI.
Mm-hmm.
And by the way, sales can be done over an email, over phone, over social media, like LinkedIn. You can find doctors on LinkedIn.
Sure. Any number of different
copyright,
venues.
like if you're running an ad, that's sales too.
Sure.
We use Indeed.com.
Yeah, we use Craigslist. We use all kinds of sources.
To find PIs, right?
Yeah.
Okay, next. Now you got to convince sponsors. Let's say you have a PI.
Yep.
Now, you as a research site owner, by the way, we have a site owner academy. It's fantastic.
No, we do.
Do you think it's fantastic?
Honestly, I think our CRA Academy is slightly better, but yeah, I think it's worthwhile. Absolutely.
Yeah?
Yeah.
See, I think the site owner academy is slightly better.
Really?
Yeah.
Okay.
I think it's more underpriced. Both are underpriced. I think the site owner academy is more underpriced.
Why I say it's better this year? Well, so you're looking at it probably from this perspective.
CRA Academy is more structured. It's been doing it longer. The foundation's there.
I assume you think there's more value since they can be in the site owner academy indefinitely, right?
Mm-hmm.
Whereas the site owner or the CRA academy is not so much that way.
Random question, but we gotta answer it because we told Instagram. So, can you please explain what is a NTF?
A note to file.
Note to file. When do you write a note to file?
Whenever you need to explain something.
Anything at all that you need to explain in research, you write a note to file for. And some CRAs think that sites could abuse note to files. I tend to think that that's not the case. Most of the sites I've seen don't do it enough.
Maybe there's a misunderstanding there. I could see if somebody's told you that and what they meant to say was maybe you need to be a little bit more clear in your documentation initially.
Yeah.
So you don't have to utilize note to files.
I never had a CRA tell me in person, but I've had them tell me on LinkedIn when I did a video on note to files, which you can just Google or YouTube note to file on YouTube and you'll find it. But I've had someone comment on one of my videos, hey, note to files can be abused by sites, meaning they're doing too many.
Yeah, which could mean their initial documentation is just not sufficient.
Right, and I agree, but I think 99% of the sites underutilize note to files.
Sure, anything that's not clear should require a note to file.
Including our own sites.
Sure.
They underutilize them. Note to file can cause you more problems. Stay away from them. Uh-oh.
Who's saying this?
I don't know. Somebody's saying note to files can cause you more problems. Stay away, young man.
I would disagree, but
Yes.
you would disagree as well?
I don't know. Person has a good point. Maybe.
It depends on where you're coming from, right? So, let's say that, what would be a good example of when a note to file would be required? Well, let's say the document...
Basically what they're saying is maybe you're digging yourself your own grave by writing note to file. So yes, you got to be careful what you're writing.
Well, let's say that something in the source documentation is not clear, right? It's ambiguous, right?
Mm-hmm.
Well, guess what? You can write a note to file to clear that up.
Yeah. Okay. But what they're going to argue, and they haven't written it down yet, but playing devil's advocate, they're saying if you have a coordinator who maybe doesn't know the protocol, or maybe a PI doesn't really know the protocol and they're just writing a note to file, they could be documenting that they're not following the protocol or something, or even not following GCP.
Well, that could be true of any instance, right? Your initial documentation could be that as well.
Yeah.
So you have to know the protocol, of course.
Doc. We got Doc on. What's up, man? Doc's another CRA Academy student. Okay, so I don't know how sales turned into note to file. Would have never guessed. Finding studies, right? Is that where we were on?
Yeah. Well, I think we're finishing up PI.
So anything left with PI that we left out?
No, covered that.
Okay. Oh, regarding note to file, regarding Site Owner Academy, do people without CRA experience tend to have? Hold on. The one about note to files. Oh, we got some questions now. I gotta work. People tend to overuse. FDA loves note to file. Open a can of worms. Yeah, I could see that. You gotta be careful with them. But still, most sites underutilize. You should use it when it helps you, not when it hurts you. Regarding Site Owner Academy, do people without CRA experience tend to have the ability to become a successful site owner? Yes. The best site owners, in my opinion, well, maybe Chris has a different take on this. Who do you think makes the best site owner? We had a rule once that we will only invest our money into a site if the primary owner is a coordinator.
Sure.
Do you still believe in that?
Well, somebody at least with research experience, right? PI, CRA, CRC.
From those three, who's best to be the site owner? They all could work and they all could fail.
Well, again, it depends on the personality, but I guess in general, the CRC.
I think so too.
But a big part of that's the personality too.
I think the CRC's slight edge over the CRA because the CRC has experience interacting with patients, whereas the CRA may not, unless the CRA was a CRC first. PI is good because they're a doctor.
Right.
It's always good to have a doctor owner. But yeah, anyone could be a successful site owner as long as you have entrepreneurial tendencies. Can a site not get selected for a new protocol if the site estimates that they will use... Can a site not get selected for a new protocol if the site estimates that they will use a higher amount than what the sponsor has in mind? This is about budgets, negotiation.
Use a higher amount.
So
of
here's what they're
advertising?
saying.
Are they saying use a higher amount of advertising than necessary?
No, they're talking about budgets. So you know how in feasibilities, sometimes they'll ask.
Well, I think that could mean advertising too, but you're right. It could mean what
clarify
you're saying.
while we talk, but I think I'm right. I'll bet you $20 on this. So live on Instagram, we can't go back now.
I didn't bet anything. I have no idea. I'm just saying it could be advertising as well.
So you know how in feasibilities, and we had a client ask us this
Sure, I know exactly where this goes.
So sometimes in feasibility surveys, they'll ask you, what is your estimated overall per visit or for the entire amount? So for those listening, you might be confused as hell right now. because we're doing Instagram and people are listening on podcast. In feasibility surveys nowadays,
about 10% of the time.
10% of the time, they ask a question that states something along the lines of, how much do you anticipate it will cost you to
Per completed patient, something like that.
after you read the protocol, to complete a patient for the protocol.
Oh, sometimes they ask that question without even providing the protocol.
Which
All
is
they provide is the
ridiculous.
inclusion and exclusion, not even a schedule of assessments. I've seen it.
Which is ridiculous.
And my answer is always, well, for the typical trial, since no schedule of assessments was provided, this amount, right? Because I have no idea what's involved in the study at this point. What assessments were required.
So on the feasibility survey, I go low on if I'm ever asked this question.
I would say 30 to 40% under what you're actually going to ask for.
And no one's going to hold you to that. So this will answer your question. No one's going to hold you to that when it's time to do the budget. Now, the sponsor usually gives wiggle room for the budget if the site looks promising. Oh yeah, they give a lot of wiggle room. Go through the green light, yellow light, red light scenario for sites. The way sponsors look at sites.
So, I assume all sponsors do it about the same way, but I'm familiar with one sponsor in particular, and they have a traffic light system for designating individual sites they've worked with. So red light means for this particular sponsor, they will never work with that site again. They're not to be used, period. Yellow light means we had issues with this site, and they'll probably detail it somewhere in the notes, but it's okay to maybe use that site. You just need to do a little bit more further evaluation. Green light means you're good to go with this site. It's a perfect site, right? That is great, and they always enroll or over-enroll the number of patients they promise. So I assume where Dan's going with this is a green lighted site typically will get more funding than a yellow, of course, a red light.
Tons more wiggle room. And again, this is where sales comes into play. Like when you start doing, and we haven't even gotten to the negotiation. This might be a long podcast. This is going on 24 minutes. When you get into the negotiations of the budget, sponsor's always going to come back at you with fair market value, Sunshine Act. They're going to throw all these things at you. Well, you got to know where you stand. What kind of site are you? You got to take a guess. Are you a new site that has no leverage when it comes to negotiating? And by the way, if you still show promising numbers, you still have leverage, right? And by numbers, I mean patient enrollment capabilities. If you're an established site with a proven track record, you have more leverage. If you're a key opinion leader, you probably have the most leverage, right?
Especially if you also have good data.
So we're going to get into that when we get into the negotiating part of this sales podcast. But you get more than wiggle room, I would say. We got another good question. Here's one that Chris might like. I guess we can say that it has something to do with sales. What are your thoughts on loss to follow-up? Gazelle's asking. If a patient withdraws consent, is that loss to follow-up? I've heard yes and no is what.
So I would say no, because to me a loss to follow-up patient is somebody that didn't come in for a visit and you have no idea what happened to them. Basically, you don't know what happened to them. Somebody who withdraws consent, you know what happened to them. They said, the drug didn't work for me. It's causing side effects.
Yep.
I'm moving away. You know what occurred. They're not lost. You have an end result. You know what caused the end. Loss to follow-up is you have no idea. This patient may have died, God forbid, but they may have died. You don't know what happened.
The community agrees with you as our PI rolls in. There she goes.
Mm-hmm.
Okay. Someone said if a patient withdrew consent, that is not a loss to follow-up because though they were still bring the patient back, he didn't want to do the study, he has that right. Yeah, I think it's a withdraw consent. Yep, correct. Another question, what is the average initial startup cost for a new site?
Well, I don't know, right? So there's a number of factors in the startup costs. if you mean to say what is the average you can get from a sponsor, I would say it's $5,000.
I think they want to open a site, and it's just going off the context of their previous questions.
Yeah, I would say it's 5,000. I'd say the answer to your question is you can typically get $5,000.
No. They want to open a clinic.
Oh, my apologies.
Yeah. I think.
Well, there's a number of factors there as well. It's how much is the rent, how much you're going to pay your PI, how much you're going to pay a coordinator.
And that's all sales, right?
Sure.
People are always looking. Another thing we noticed, people are always looking for rules.
Of which there's very few in this industry.
Best practices when you're opening a clinic. I mean, there is no best practice. What can you negotiate? Like someone asked me recently, and this gets asked a lot, what is the best practices when negotiating with a PI for becoming a PI for your site? There is no best practice. You figure out what works for them, what they want.
Being a chameleon again.
Figure out what works for them. If it aligns with what works for you, you do it. If it doesn't, you renegotiate. If it still doesn't, you move on. Like, and you're not going to go one for one. The first doctor you talk to is probably not going to join your site. You said it's going to take 15 different conversations with a doctor to find one interested PI. I think it's more like 10, but again, around that number, way more than people think.
Right.
People think, hey, I know a doctor and I want to open a site.
Yeah, I need to go propose this to them and they're on board.
It's a good start. It's unlikely to be a winning strategy, but it's a good start. And then if that doctor, things don't work out, you ask them to refer some colleagues. You talk to those colleagues, you ask them to refer you to their colleagues. Pretty soon you're talking to 10, 15 doctors and you get, come on back. Pretty soon you're talking to 10 or 15 doctors and you'll find one. So thank you for that question. Let's see, where's the other one? So that's the initial startup cost for a new site is the rent. So are you going to be, and again, this is where sales comes into play. Are you going to be renting your own space or are you going to find a PI with an existing office space and then through sales, through negotiation, convince them that they should do research with you in their office space in exchange, usually, for a higher percentage of the payment to them. So I would go as high as 50% of the gross revenue if they're willing to let you use their office space rent-free, provide you with patients, provide the oversight, obviously, that a PI needs to provide. Maybe even have you utilize some of their staff, like medical assistants to draw blood, get them GCP certified, of course, get them IATA certified if they're going to be processing labs. So that's a big cost is the rent, right? That's a huge variable. You can either, and depending on what market you're in, you could be paying $5,000 a month or you can pay $0 a month if you negotiate with the right doctor and if it's a good fit for them. So this is where you just have to have conversations with more people. So that's the rent. Then it's the coordinator. Do you need to hire a coordinator or can you do it? If you're going to hire a coordinator, again, depending on what market you're in, it's going to run you anywhere from $40K to $90K a year, depending on experience of the coordinator and what market you're in. On average, it's about $60,000 a year. So that's obviously a huge expense. Can you be the coordinator, right? Then you don't have any expense except your own living expenses. And then you live off of the profits, which if you do it right, in 1 year, you can get 3 studies as a startup site. 3 or 4 studies, I think, is a realistic expectation for a startup research clinic. And you can generate gross 150K per study, gross, which could be for 3 or 4 studies, 300 to 500K a year gross. Now, let's say you have to give your PI half of that. Okay, so you're giving your PI from 300,000 gross, you're giving them 150K gross, and that's like a high amount to pay a PI. But if you're not paying rent, maybe it makes sense. Give them 150. and now you're the coordinator. Now you're just making $150,000 a year. You're doubling the income of the average coordinator anywhere in the country, and that's off of 3 studies. Now you're working just as hard, probably harder than the average coordinator, but the average coordinator works pretty damn hard too. So you can see why a lot of coordinators want to open their own sites. You can see why a lot of CRAs want to open their own sites. The problem is, it sounds like a great idea, but if you don't know how to run a business and you don't have patience, meaning the ability to not make any money for 6 months in exchange for, or even your entire first year. Maybe you're not making any money your first year. How are you paying your own bills? How are you living off of that? I know a lot of CRAs that continue to be CRAs and then on the side run their own sites by using assistants, and once the site gets successful, then they move on to full-time managing the site. So there's a lot of variables there as far as like startup costs. And then when it comes to equipment, it's actually not very costly. I have a page on my blog, The Clinical Trials Guru. There's a tab that says start your own clinic, get equipment. And first of all, if you're partnering with a doctor and using their office space, they probably already have most of these equipments. But let's say the doctor has none of these equipments. It's about $6,000 to $7,000 to get all the bare essentials needed to start a clinic. And then you just got to get to work, right? Go get the studies. Biz dev needs to start from day one. The minute you have a PI and you decide to do this, you need to start biz deving, meaning approaching sponsors and CROs for studies, working with consulting companies like myself and like Chris's, and there's others. We have competitors, but utilizing services or just doing it yourself, learning how to go on clinicaltrials.gov. Again, this podcast is all about sales. Have a good email pitch, and there's no perfect email pitch, but they need to be short, they need to be concise, but they need to have all the information that a sponsor is interested in, meaning how many patients can you get, how many years of experience do you have in this therapeutic indication, who's your staff, where are you located, central IRB, local IRB, these things matter. And to get good at sales, it's not just in person or on the phone, it's having these good email scripts down too, and then following up with the sponsors, and then repeating, and then doing it over and over and over again. You need to reach out, from my experiences, to about 100 leads from clinicaltrials.gov in order to get 10 responses back. Maybe you'll get 7 CDAs, and maybe from those 7 CDAs you'll get like 5 or 6 surveys, feasibility surveys. From those 5 or 6 feasibility surveys, maybe 3 of them, maybe 2 or 3 will want to do a site selection visit. And then hopefully you're 100%, you're batting 100 or 1,000 when they come to your site. Because like I've said before, like Chris has said before, once you have an SSV, which is a site selection visit, it's yours to lose. But if you lied on your feasibility survey and said that you are an expert in research and your PI is an expert in research, and in reality, when they show up, when the monitor shows up at your clinic and your PI says you've never done any research, well, that's obviously not consistent with the feasibility survey. You can lose the study. So pay attention to what you're putting down on your survey, and then pay attention to whether that conflicts with what you actually say in person. Same thing with your enrollment estimates. If you estimate on a feasibility survey that you're going to randomize 50 patients, and then when they come to your site, you tell them you estimate to enroll 5 patients, well, what changed between the time that you did the feasibility survey to the time that they asked you the questions? And who filled out the feasibility survey? And then why is the PI saying something totally different? You guys all need to be on the same page. And then if you get nervous or anxious during the SSVs because someone's calling you out on a lie or on an embellishment, it's just going to spiral out of control and you're not going to get the study. I've seen it happen before. Hasn't happened to me, not to that extent at least. I have lost studies at the SSV, but just be consistent. Pay attention to what you're putting down on your feasibility surveys versus what you're presenting when the monitor comes in person. And maybe you don't have experience or not a lot of experience, but you have a lot of patience. Like, always lead with your strengths. So sites that have no experience but a lot of patience, which is a lot of research naive sites, they need to lead with their strengths, right? And maybe the PI was a sub-I on studies in the past. Maybe the coordinator has a lot of experience but not the PI. Maybe the PI has a lot of experience but not the coordinator. Lead with your strengths. Figure out what your strengths are and then lead with that, and don't lead with your weaknesses. And if they ask you about your weaknesses, try to reposition it into your strengths. That's a strategy I always use. I really wish I can film a site selection visit. Haven't done that yet because monitors don't like to be on camera. They're camera shy. But take my word for it, if you haven't been in an SSV, you will be nervous on your first site selection visit, but you will get better as you do more. So, talking about site selection visits.
Wow, we've only there?
Yeah, we've only gotten there, man. We're finishing that up, but be consistent with your SSVs. If you've never done an SSV, you will be nervous as hell on your first one. My first day of doing research at a site. I thought I was gonna be an intern. I had no clue that I was gonna eventually take over that site and be the owner and then start blogging and all this. 2005. I was a pre-med student. My first day starting.
Had a site selection visit, huh?
Was a site selection visit. That's why they were cheap. They're like, no, start this day. It's an SSV. We need a backup coordinator. I didn't even know what that was, but I said, okay, well, I'll do it. 23 years old. I was like, I'm only going to do this for a few months, and then I'm going to med school. First day. Not first week, first day. First 5 minutes, I show up in the clinic. I'm like, hey, I'm Dan. I'm here to start. Coordinator, stressed out, grabs me, pulls me aside, says, hey, you're a backup coordinator. And I'm like, okay. I don't know what that means, but okay. If they ask you if you're PAN certified, you say yes.
Mm-hmm.
I was like, pants? I thought she was saying pants. She was saying positive and negative symptoms of schizophrenia.
Mm-hmm.
So, okay. So I was nervous as hell, and the monitor's going around the room asking, and she's like, you PAN certified? I'm like, yes, I'm PAN certified. Nervous as hell.
Did you say pans or pants?
I just said yes to whatever she asked. I'm like, yes, I am this.
Okay.
I had no clue what I was doing. We got the study, but I was nervous as hell. But guess what? My second SSV,
no problem.
much less nervous.
Hey.
My third, and then so on and so on. So there's no way to avoid, and chances are you're not going to be thrown into the fire like I was on your first one. You'll have some time to prepare. And if you're a client of ours, we'll prepare. One of the things we do is we prepare you before your first SSV. We'll do it with you over the phone. You actually do this with clients all the time, right?
Yeah, usually spend an hour with the coordinator and PI if they're research naive, discussing everything that will occur or to expect that will occur during a site selection visit. Getting back to your story though, real quick.
Yeah.
So my first day, very, very first day.
I told you to do the same thing?
Yeah, mine wasn't an SSV though, it was an SIV. So not as stressful.
Oh, it was an SIV.
My very first day.
That's actually worse.
No, I think that's not as stressful.
SSV, they only stay for like 2 hours.
Yeah, but the SIV, you already have
SIV,
the
they
study.
stay the whole day.
But you already have the study. You're not losing. There's nothing to lose, right?
Yeah. We got some more good questions. But yeah, continue with this story.
No, it's the same as yours. It was just my first day.
So what happened?
But I wasn't the backup. I was the coordinator.
Was I there?
For like 10 minutes.
I was there for 10. What did I do?
I don't recall.
I just showed up and left. I didn't tell you to do anything.
No, you just said nod your head a lot.
I said that.
Something like that.
Chris, if they talk to you, nod your head a lot. That's actually, we can end the podcast on that. If you're nervous about your SSV, nod your head a lot and smile.
Well, unfortunately, that won't always fly. 'Cause they're going to ask you about numbers and things.
Yeah, well, then you have a PI. Or you can, if DSCS is your consultant, you can
We'll
phone
tell
us
you
in.
what to say. I don't think that would play too well.
No, it wouldn't play well. We'd prepare you beforehand with like 85% of the questions. They can always throw curveballs at you that we didn't prepare you for.
Sure.
Okay, here's another question. This relates to sales. Anything relates to sales. Do you think being certified in research gets you better opportunities as a coordinator?
Maybe a little bit, yeah.
Yeah, I think so too.
I don't think it's going to bring you more studies or recite more studies necessarily, but I think it'll open a few more doors for job opportunities. Yeah.
Job opportunities, yes. Study opportunities, like if you're a site owner and you want to get certified. We had a call today.
Yeah.
Somebody wants to open a site. They already have a master's in research. Now they want to get ACRP certified. Like, you don't, first of all, you can't even do that. You need 2 years of industry experience to get that. But you don't need more credentials. But if you're looking for job opportunities, yes, doesn't hurt to do that. Get as many certifications as you can. I don't have almost any, except GCP. Sometimes sites see that as a measure of your experience, and this can offer you more money. I'm curious to see what Dan says. Typically, sponsor like to hear the staff is certified. Of course they do. But it also depends on who your PI is. If he's reputable, chances are, if your site is high enrolling, people may look at your CRCs as valuable. Yeah, I mean, all of that's correct. It doesn't hurt to have certification. I've never had any certifications other than GCP. Right? NIH, Protecting Human Research Subjects. IATA.
And then different rater assessments.
Yeah, like we do a lot of psychiatric studies, so there's like dozens of assessments that you got to get certified on. So I have those kind of certifications. But as far as like ACRP, SOCRA, I think those are great if you're going to do it. If it's stressing you out or you can't afford it, I don't think it's necessary. But if you're a lifetime employee and you want to climb the corporate ladder and get better opportunities for yourself, of course, anything like that will help you out. Any thoughts on this?
So when it comes to getting studies, like we told the individuals we talked to earlier, it will help a little getting a trial, right? If the staff's all ACRP or SOCRA certified.
Especially the PI. This person made a good comment. If the PI, very few PIs are ACRP certified.
Sure, but you know what I think is way more important is your capabilities to enroll in that trial. If you had one or the other, hey, I don't know how many patients I can get, if any, or I'm ACRP certified, well, guess what? You're not going to get the study ACRP certified in that scenario. What you're going to get, when you're going to get the trial is when you can get the patients.
So my throat hurts. I've been battling this cold. What's after SSV sales-wise?
Okay, so you get the study.
Yeah, you take over. My throat hurts.
Okay, so after this, so let's assume you've got the trial, right? They've ordered your site to trial. So now you have to enroll patients, right? So there can definitely even be salesmanship in that, right? You have to go to patients. You have to discuss the trial with them. You have to tell them what known side effects there might be, but you also have to tell them or sell them on why they should join the trial, right?
Mm-hmm.
So there's sales involved in explaining to an individual why their participation in a trial might be beneficial to them, right? And even some salesmanship on, for example, right, in all new drugs, I'm sure everybody's seen the commercials on TV for the side effects. Most of those are, most likely not even in regards to the use of the drug, right? For example, everybody gets headaches. Everybody gets an upset stomach. Say a 6 month or year long period of time, right?
Yeah.
So those reported side
look
effects.
Look at me today. I have AEs like all over myself.
Right. And if you are currently in a clinical trial, well, those would be reported as the side effects of this drug, right?
Yeah, sore throat,
Right.
runny nose.
But they have nothing whatsoever to do with the drug. So a lot of those side effects aren't even related to the drug, right?
Yeah.
But there's no battle put in dismissing those because people aren't going to care too much. It's not going to hurt the sales of the drug if it's going to cause one of the side effects or a headache, right?
Yeah.
It's the more serious side effects that they'll try and get dismissed, death or something of that nature, right? Because you may not want to take a drug that might kill you.
Yeah.
So those limited side effects or those minor side effects probably don't even occur when taking the drug.
I've got something for you beyond tradition. So we were talking about CNS studies, and they were saying there's socioeconomic studies. They're saying a lot of psych patients don't participate in those kind of studies. Chris and I were actually working on a startup through the Clinical Scoop, where we are, and we're actually we need to call this lady after we're done.
We already talked to her.
Today?
No, we talked to her like a few days ago.
Yeah, she was supposed to get back. So we're trying to submit a grant to the NIH to fund our project. It's all about minority and female participation in clinical studies. So we're trying to do something for that. But yeah, like you said, you can advertise payment, drug, etc., especially for people who can't afford the drug. Absolutely, there's a tremendous need for this. In psych and oncology and OBGYN, I mean, it's a huge problem in the industry and something that we're trying to work on. Okay, so more sales.
All right, so bringing patients into the trial requires some salesmanship, right? And I guess before that, right, you were going to bring up the budget, right?
Negotiate, that's all you, man.
Well, I don't know if that's so
I used
much...
to do that.
I don't know.
Now we have you.
I mean, there's some sales involved in that, but minimal, right? So if you have a ultimate dollar sign in mind for, say, a completed patient, and you're just not getting there with the sponsor, I guess a phone call to the sponsor and explaining how your time is worth this dollar amount, and how you're going to provide, great data and enroll so many patients, it's just worth their while to pay you this dollar amount. I mean, sure, there's some salesmanship there, a little bit, right? But I think negotiating a budget's more just about negotiations, right? Most of this is conducted via email. There can be some salesmanship there as well. I think it's limited, the amount of salesmanship in negotiating a budget, right? But there's definitely a time when it could be necessary, right?
Well,
selling your site, your capabilities.
It's always necessary. So sponsors are look. They're looking to. I mean, obviously they've selected you. By the time you start negotiating, they want to use your site. Okay, so at this point, they're just trying to keep costs down for them as much as possible.
Sure, it's a business.
And we've been told CROs are actually the people negotiating for the CROs get rewarded by how much they can save.
Sure.
As an incentive. You as a site, you're on the other side of that. Like, you want to try to get as much as you can. Again, know your strengths, know what you can leverage. They're going to throw everything at you when you negotiate, and people get intimidated. They're going to throw the Sunshine Act at you. They're going to throw fair market value. You're going to hear those two things till you're blue in the face, right?
And they also, kind of in a threatening way, say, well, we can take this to the sponsor if you're not happy.
Yeah.
And it's phrased in such a way that it seems kind of threatening. Like, if they do so, you might lose the trial.
Mm-hmm. And most naive sites at that point would be like, no, let's accept what you have.
Yeah, that's exactly why they say it.
But you tell them, go ahead.
Yeah, please do.
And then, have you ever lost a study from that?
No, but one I've kind of lost and one I've declined. So it comes back from the sponsor.
But from the hundreds that you've done this with.
Yeah, it comes back from the sponsor and they say this is the best we can offer. And one said, well, we're not interested in your study because I said this is the least amount we can accept.
Oh, yeah. So get informed, like when they throw these words at you, and if you're thinking of starting a clinic, when you're done listening to this, podcast, go Google Sunshine Act, go Google fair market value and clinical research, and get informed.
Sure.
Right? Because these are things that are... The Sunshine Act was never meant to be about research. It was meant to disclose what pharma companies are paying physicians, mainly for speaking about drugs. Like if I'm a doctor and I get paid by Pfizer to speak about Viagra, that should be transparent. Like there's a website where it will show anyone who looks me up, this guy received X amount of money last year from Pfizer.
Yep.
Now, research gets thrown into that.
Right.
Right? And I think it's because the KOLs, key opinion leaders, sometimes get rewarded and maybe overcompensated for speaking by doing research.
Right.
When in reality, it's just another way for them to monetize. But that's like 5% of sites. Unfortunately, anyone who owns a site gets thrown into that category. So they're going to throw the Sunshine Act out at you, and you can let them know, yes, but Sunshine Act is not really about this. It's about speaking, and this has nothing to do with the Sunshine Act. You can get around those things. Same with fair market value. Well, what's fair market value? It's what someone's willing to pay for something. Right?
Yeah.
Take something as simple as an MRI fee. There are some vendors in Southern California that charge like $1,300 for an MRI. Some charge $6,000 for the same MRI. Where's the fair market value? You can argue it's $7,000 if you want.
Sure.
It's not that far from $6,000.
I would say fair market value is what most vendors accept or pay.
Yeah. Anything else?
So patient recruitment requires some salesmanship. What about if your site
Patient retention?
Yeah. And what about if your site gets in trouble?
With who?
Sponsor, CRO. What if they get in trouble, right? So
You gotta start selling and dig yourself out of your hole that you're in.
Yeah, right. Right? They're dissatisfied with the quality of your data. Right? They're thinking of shutting your site down.
Yeah.
So a little salesmanship required, right? Guess
Right.
what? We're going to retrain all the staff. Things will be perfect from here on out, or close to.
Corrective action plan.
Yeah.
We're bringing in a sub-I and everything's gonna be fine.
Sure.
Sounds familiar.
It does, but it's required.
Okay, so anything else?
You have to appease people with sales at times.
Anything else? More sales. Everything's sales.
Oh yeah, everything. If you want
What
to be
do
an
you-
entrepreneur, it requires salesmanship.
Or even if you just want a better job.
Yeah, you have to sell yourself.
Or even if you want your job to be easier. As a
Yeah, I don't know.
example, I'm a part-time CRA.
Okay.
I forget something at one of my sites. I want them to get it done or to send it to me. It requires a little bit of sales, right? Interpersonal skills. If I wasn't asked to that site,
Yeah, they're not going to want to help you at all.
right?
Sure. But I guess you could argue being friendly and sales are kind of one and the same. But I think
Empathy.
I think just being friendly will get the job done. I don't think necessarily sales are involved. You don't have to persuade anybody. I think the term, for me, sales is more synonymous with the term persuade.
Okay. Persuasive.
Right. I don't think you really need to be persuasive with your sites as a CRA. If you're nice with your sites, they'll usually return in kind, right?
How often? We only got a minute left. Instagram's kicking me off. It says, look at that clock. I never seen this. 1:10 and counting. How often does the FDA audit sites? Not very often. Anything else?
No, but just to elaborate on that, we've been doing this for a very long time. Knock on wood, have yet to be FDA audited.
Yeah, knock on wood. So, gonna end this live stream. Podcast is going to, it's just a sales pitch now. What?
Sure.
Just pitch our services as the clock expires.
Which one?
All of them. Be a salesman.
So we have the Site Owner Academy. If you're interested in starting your own site, doing as we discussed here today, we certainly can help with this and teach you the fundamentals of owning your own site. We have client services in which That's 1,000. The Site Owner Academy is 3,000 a month. We have client services. That's 1,000 a month, and we'll help you with everything involved that can be done remotely. We're not going to recruit patients for you. And we're not going to necessarily review data, though we could. We have a new site that came on board that wants us to do this for them. And that's an extra added fee, though, on top of the 1,000.